OSGOOD SCHLATTER disease is an orthopedic disease. Look at this picture, shows that knee joint, patella tendon, loosen. Look at this. And X-ray findings. CT. Look at this. And MRI findings. Detail going on. Introduction. OSGOOD SCHLATTER disease OSD is a common cause of knee pain in growing adolescents. It is considered a traction apophysitis resulting from repetitive stress or tension on the tibial tuberosities growth plate where the patellar tendon attaches. OSD is self-limiting and typically resolves with skeletal maturity. Definition: OSGOOD SCHLATTER disease is a self-limiting overuse injury in adolescents caused by repetitive stress on the tibial tuberosities growth plate where the patellar tendon attaches. Leading to pain, swelling, and bony prominence below the knee. It typically resolves with skeletal maturity and is managed through rest, activity modification, and symptom relief. Types: 1. Unilateral OSD affects one knee. 2. Bilateral OSD affects both knees. Though one side may be more symptomatic. Causes: 1. Repetitive activities, sports involving jumping, running, or rapid direction changes. Example: basketball, soccer. 2. Growth spurts. During adolescence, bones grow faster than tendons, increasing tension. 3. Overuse injury, strain on patellar tendon during activities. Risk factors: 1. Age, common in adolescents age 10 to 15 years. 2. Sex, more frequent in male but increasing in females due to greater sports participation. 3. Physical activity, involvement in high impact sports. 4. Growth spurt, rapid skeletal growth can increase susceptibility. 5. Tight quadriceps, increased stress on the patellar tendon. Complications. 1. Chronic pain. Residual knee pain may persist into adulthood. 2. Bone sports, bony growths at the tibial tuberosity. 3. Functional limitations, difficulty in performing physical activities. 4. Fracture, rarely avulsion fractures of the tibial tuberosity. Pathophysiology. OSGOOD SCHLATTER disease occurs due to repetitive microtrauma at the tibial tuberosity during growth spurts. The epiphyseal plate, growth plate, remains weak and susceptible to stress. Repetitive pulling of patellar tendon on the growth plate leads to inflammation, pain, and bony changes such as prominence or fragmentation of the tibial tuberosity. Pathophysiology of OSGOOD SCHLATTER disease, step by step process. 1. Rapid skeletal growth. 2. Repetitive stress on the growth plate. 3. Traction at the tibial tuberosity. 4. Inflammatory response. 5. Bone adaptation and overgrowth. 6. Symptom manifestation. 7. Resolution over time. By understanding these steps, the characteristic features of OSGOOD SCHLATTER disease, localized pain, swelling, and prominence of the tibial tuberosity can be traced back to the underlying pathophysiological process. Signs and symptoms. 1. Localized pain at the tibial tuberosity worsens with activity. 2. Swelling around the tibial tuberosity. 3. Tenderness upon palpation of the affected area. 4. Prominent tibial tuberosity, visible or palpable bony protrusion. 5. Pain during activity, especially running, jumping, or kneeling. 6. Stiffness in the affected knee, particularly after rest. Diagnosis. 1. Clinical history and examination. History of knee pain aggravated by activity. 2. Tenderness and swelling over the tibial tuberosity. 2. Imaging on X-ray reveals fragmentation, prominence of the tibial tuberosity. 2. Ultrasound can detect soft tissue changes and inflammation. 3. MRI for detailed evaluation in severe cases. Nursing diagnosis: 1. Acute pain related to inflammation and repetitive stress. 2. Impaired physical mobility due to knee pain and stiffness. 3. Activity intolerance related to pain during physical exertion. 4. Knowledge deficit about disease management and prevention. Management. First, medical management. 1. Pain management. NSAIDs like ibuprofen and acetaminophen. 2. Physical therapy. Stretching and strengthening exercises. 3. Activity modification. Limiting activities that exacerbate symptoms. 4. Bracing and support. Knee braces or straps to relieve stress on the patellar tendon. Nursing management. 1. Pain assessment. Regularly evaluate pain levels and response to treatment. To education, teach patients and families about activity modification and exercises. 3. Cold therapy. Apply ice packs to reduce swelling and pain. 4. Encourage adherence. Reference the importance of therapy and follow-up. Treatment. 1. Conservative treatment. Rest and avoidance of triggering activities. Stretching and strengthening of quadriceps and hamstrings. Ice application and anti-inflammatory medications. To surgical treatment rarely require, indicated for severe cases with persistent pain or bony fragments. Removal of bony spurs or ossicles. Psychosocial medicine. 1. Emotional impact. Adolescents may feel frustrated due to activity restrictions. To support, encourage participation in low impact sports. 3. Counseling. Provide recurrence about the self-limiting nature of the disease. Prevention. 1. Gradual warm-up prior to physical activity. 2. Flexibility exercises, regular stretching to reduce strain. 3. Proper training techniques, avoid overuse and excessive training. 4. Protective equipment, use knee braces if needed. 5. Adequate rest between endurance activities. In conclusion, OSGOOD SCHLATTER disease is a self-limiting condition linked to overuse and repetitive stress during adolescence. While conservative management effectively alleviates symptoms. Patient education and adherence to treatment play a crucial role in recovery. With timely intervention and preventive measures, most adolescents recover without long-term complications. Thank you. Have a nice day.